Are you struggling with acne and you want to clear it naturally and holistically without medication? In this video, I share how you can start doing that as I help my own patients as an integrative skin and hormone doctor. Now, I follow these guidelines myself whenever I break out. I've always had acne-prone skin since I was a teenager, and then even now in my 40s, I still get the odd breakout. But through the years, I've learned my own skin triggers and I know how to calm it down. If you'd like to know your own potential skin triggers, I recommend you watch my video, 10 reasons why your acne is not clearing. It will help you understand your potential root causes better. I'm not going to lie. Life just seems just a little bit easier to handle when our skin is clear. When there are challenges that are overwhelming, the last thing we need is another pimple to worry about. The problem is stress makes acne worse, and acne makes us feel more stressed. This is because stress increases the stress hormone cortisol, which when persistently high can cause havoc to your gut, your immunity, your hormones and your sleep, which then leads to increased inflammation and reduces your skin's ability to repair. So how do we break the cycle? The answer is to reduce inflammation. Now, inflammation is our body's natural immune response when there is a dangerous threat or harm. This can be triggered by internal or external causes. However, when inflammation becomes uncontrollable or persistent, that's when problem arises. To start clearing your skin, I will focus on anti-inflammatory foods, anti-inflammatory skincare, and anti-inflammatory lifestyle. Let's start with anti-inflammatory foods first. Now, there are common foods that are more triggering than others. This can be caused by the food itself or because you have a problem with your gut. Example, leaky gut syndrome. This is when your gut lining is leaky or you have holes in between the tight junctions, so it allows partially digested food to go through. The body doesn't recognize it and then it sees it as dangerous and produces antibodies to fight it. The next time you eat the same foods, your body's going to see it as potentially harmful due to the antibody's good memory, and it will then lead to an inflammation. For the next 21 days, I want you to try removing dairy, gluten, eggs, sugar, peanuts, corn, and soya. Now document how your skin feels and look. After the 21 days, you want to reintroduce these foods one by one. So for example, you would add dairy first, for the first 3 days and see how it goes. And then after the 3 days, then you would probably add gluten. And then after the next 3 days, you would add eggs. Now with the eggs, you might want to separate the egg whites and egg yolks because I've actually seen some patients sensitive to one and not the other. Now document what happens to your skin or even how you're feeling every time you add this new food back. If your skin is clear, fine, you can reintroduce back, not a problem solved, so you're good. But if your skin reacts, you might want to maybe leave it off another, a few more days or 3 weeks. Sometimes some patients aren't always intolerant to it. So for me personally, I don't do well with dairy. I love cheese especially. So I know when I do have cheese, I will potentially break out the next day. I've learned how to mitigate the negative effects of dairy, so I'm just a bit more aware, really, So if I got a big date to go to, or have a big presentation, or maybe doing a video like this, I won't have cheese the previous day or the same day. Now, during these 21 days, as you're removing foods, you want to make sure you're adding foods back as well to alkalize your body, boost your detox system, and also support your repair process. I don't believe in restricted diets because it can potentially add more stress to your body and produce more inflammation. So it's important to replace what you've taken out. I'm going to list some foods next, so feel free to take a screenshot of the food categories so you can keep it for reference. This includes good protein sources to stabilize your blood sugar levels, complex carbohydrates to help with bowel movements and providing energy, cruciferous vegetables for supporting liver detoxification, red, orange, and yellow fruit to provide vitamin A and vitamin C, which are all crucial for great skin, and immune boosters to boost your immunity. Now, if you have milk or like milk, try nut milk instead. I would avoid oat milk because it contains a lot of inflammatory oils and usually high in sugar as well. If you need to add sugar to your food, then I would try a monk fruit extract, which is a natural sweetener, and it doesn't affect your blood sugar levels or your sugar regulating hormone called the insulin. Now we want to minimize the blood sugar spikes, kind of stabilize your insulin levels, because if you have massive sugar spikes or many sugar spikes throughout the day, if you have persistently high insulin, this can actually increase the oil production in your skin, actually increase the production of testosterone, which then leads to more oil in the skin and then more cystic acne. So that's the inflammatory foods section done. If you have any questions on the section, let me know below. The second focus is on anti-inflammatory skincare. Now, this is actually quite simple, but for some of you, you might struggle as you're so used to using the acne products that has been recommended or promoted. So you're so scared to stop using it. Unfortunately, a lot of acne products are just too aggressive. This can affect the skin's epidermal barrier, leading to leaky skin. So similar to what I said earlier, leaky gut syndrome, leaky skin basically means there are holes in the skin, and this increases susceptibility to environmental triggers, making it more sensitive and your skin much more redder. It also increases transepidermal water loss, which means water evaporates from the epidermis, leaving your skin much dehydrated, and your skin's going to compensate by producing more oil to protect the skin. And then lastly, this can also affect the skin microbe, which is basically a fancy name saying that your protective good bacteria, which is similar like your gut really. You know, you got the good bacteria and the bad bacteria, and you want to make sure you have enough good bacteria so you can fight out the bad bacteria. So if your epidermal skin barrier is impaired, then it would just it can increase your skin susceptibility to increased risk of infection and inflammation. So when I get my patients to reduce using the harsh, aggressive products, a lot of them find their skin becomes just a lot calmer, less red, less angry, and a lot less bumpy. They have less blackheads and whiteheads. The big cystic acne seems to grow smaller as well. So for the next 21 days, give it a go. Try stopping your benzoyl peroxide, your retinols, your acids, especially your glycolic acids or salicylic acids, toners or exfoliating scrubs. You may want to try stopping your vitamin C as well, as I've seen some patients actually sensitive to vitamin C actually cause them to break out. Now you want to simplify your skincare, so I would say cleanse with a very gentle, non-foaming cleanser without any acids. You want to add or apply a hyaluronic acid to hydrate your skin. You can add a niacinamide serum, which is a vitamin B serum, which helps to calm and reduce the inflammation. And then you can end up with SPF and moisturizer. If you live in a very dry or cold climate, or if you're the age like myself, where your skin is more dry and you break out, you might want to add a facial oil, a very light facial oil on top of your moisturizer, which will help to protect your skin and also help to keep the hydration in as well. As a spot treatment, you can use a tea tree oil or a clay mask. Now, I normally recommend clay masks as a spot treatment rather than a whole face, because what we want to do is avoid, or we want to reduce products that dry your skin out, strip your skin out, and irritate your skin, so that your skin has a chance to, number one, breathe, calm down, and repair. If you want to take a step further, you might want to maybe stop any facials that you go to just for a few weeks and see how your skin responds. I've got some patients after facial, you know, they break out. Now, I know some people talk about purging, but sometimes the skin may be just irritated and it just becomes bumpy, and then sometimes it's very difficult to come back to normal, and you have another facial and the cycle repeats really. So if you want to give it a go, try stopping the facial just for a few weeks and see how it goes. Personally, I find when we do less to our skin seems a little bit happier. And the final section is actually anti-inflammatory lifestyle. What this means is making space and enough time for you and your body to rest, digest, and repair. This is called activating the parasympathetic nervous system. It's difficult and sometimes almost impossible to heal your skin if you are rushing around, really stressful, high-strung, and feeling wired but tired. That's when our body is in fight, flight, freeze, fawn, or flat mode. The aim of this system is to prepare for action, pursue your goal, and protect you from danger or harm. We still need our sympathetic nervous system because we need to survive in our daily modern life. But we also need to learn how to cultivate moments of rest and release so that we can recharge and recuperate. This is so important so we don't wear ourselves out and burn out, and we also build the resilience and reserves to face life's challenges. This can be a whole video on its own. If you're in this situation at the moment, I've been there. I was a functioning perfectionist, Energizer bunny with 20 things on her to-do list, able to say no to external demands and feeling so much pressure on myself. Eating on the go, unable to sleep, picking my skin, worrying all the time, unable to catch my breath. I've done a lot of internal work and I'm currently doing the healing work myself, and so the pace of my life is very different now. My default pace is very different now. So still got a lot to do, but it's an ongoing process, and gotta learn how to enjoy it. Slow down, pace yourself, and find a new rhythm for the life that you want to create. Create healthy boundaries to protect your time and your energy. Do something that lights you up and brings you joy. This is your life, remember that. I hope you found this video useful. If you need any extra support, let me know which one you're struggling with. Until the next video, have a great day.